Returning for another adventure with us is Dr. Joseph. Dr. Joseph, you have some things you want to share with us about testing, antibodies, and other comments, and then open for questions from residents. So welcome aboard again.
Well, thank you again, Mr. Mayor, for the invitation. I thought this morning that I would talk a little bit about the two kinds of testing that were mentioned by Supervisor Anderson, and then a little bit more of the medical components behind it. There are two tests that all of us are hearing about, but they are distinctly different. One is a nose swab, and that's called a PCR test. And the other one is a blood test for antibody. And I'll go through each of those and we can talk about when they're indicated and perhaps some of the limitations and what they mean. The PCR test is designed to detect the presence of the coronavirus, the actual material inside the coronavirus. So it's a test for the presence of the virus that lives in the back of the nose and in the throat. This is what's done in the drive-thrus that were mentioned by Supervisor Anderson, and they are present all over the county. When one goes through a drive-thru, a specially designed, very thin swab is placed into the nose and pushed in about 3 to 4 inches to the back of the nose, and that is tested. Now, the test method that is done involves PCR. It's one of the many types of molecular test methods, and so the test has got the name a PCR test. In actual fact, it is a test designed to detect the presence of a virus in a given person. The presence of the virus is diagnostic of infection. There's no reason that someone should have virus in their nose and throat without being infected. So it is very, very specific. A negative test, on the other hand, does not exclude infection. This test is not perfect, and particularly in the early stages of symptoms, this test could be negative in as many as 1 of 3. So we look at the testing two different ways. We look at the testing for persons who have symptoms and for persons who don't, and they are completely different. But let's take what is most common. That is an individual who has symptoms where he or she thinks they may have been exposed and are now having symptoms of COVID. They can go through a drive-through, be tested. And if that test is negative, it does not exclude disease if it's early in the symptoms, and they should be advised to return for repeat testing. By the time we get out to day 7, day 8, this test is almost always positive. But in the first 4 or 5 days, it will miss 30%. Now, what was also mentioned by Supervisor Anderson is that this test can be done on people who have no symptoms at all and no known exposure. This is the problem. I get calls frequently from individuals who say, I just want to be tested. I'm fine. I haven't been exposed. I just want to be tested. And that is available today. This test requires an order from a healthcare provider. It is available to any doctor or healthcare provider with a license can order the test the same as they order a blood test, but this is a nose swab test. A person makes an appointment and can get the test done. The problem is the possible false sense of wellness. So if one of my dear friends or neighbors gets tested and is negative, it's very difficult to explain what that means. And was so well said by Supervisor Anderson, that just means that you are not infected today, but you could get infected tomorrow. So for that, we've created a patient information sheet so they don't get a false sense of wellness just because they happen to be negative. Now, that said, there's another component of this. We know that many individuals shed this virus with absolutely no symptoms whatsoever. In fact, most people who have COVID infection have no symptoms. And I'm going to talk about that when we get to the other test. So as we work through the gradual reopening, which will be defined by the county health officer, we may choose to test our healthcare providers. So this would be those who are face-to-face contact with patients, because we don't want them spreading the virus. So that is a very, very unique group where testing people without symptoms can provide valuable information for the community. Otherwise, very hard to interpret. So that's PCR testing, nasal swab, looking for the presence of the virus, diagnostic if present. Now, the next test that was mentioned by Supervisor Anderson is a blood test. That's an antibody test. And in essence, that is designed to tell anybody if they have had an infection with COVID, whether they had symptoms or not. This tells us how many people have had this infection, and it's a very simple test. It will be available to be ordered by a doctor within 2 weeks. There are selected laboratories right now in San Ramon that are doing this test on a limited basis. I've been working with this for over 6 weeks, and it will be commercially available within 2 weeks, if not next week. And so the classic question that I hear from so many is, you know, when I was so sick in January or in December, do you think it was COVID? This test answers that question. Because if it was COVID, remember when we first started working with individuals with this sickness, we were telling them over the phone, if you feel well, go home, self-isolate. There was no testing done. So our numbers of patients who are reported is far below the number of individuals who have had COVID. This test tells us if they have it. It has been so surprising of what we have seen in our Bay Area when we've done a few mass screenings. And they also have been done in various metropolitan areas. And just as an example, in our area, we're seeing about 3 to 5% of individuals who have had COVID. Most of them had no symptoms. This is about 50 times the number of people who thought they were sick, about 75 times the number of people who were reported. So this test is going to be extremely valuable. So we're at 5 to 7% in our San Ramon area. Not surprisingly, New York City is 25%. Because so many people are there, the population density, it makes it almost impossible for social distancing. And a very high number of people in the New York area have been exposed, have had infection, and now have antibody. So there's a couple of good things about this. It tells us how prevalent it was in the community. It tells us who has had the infection. And there is a treatment we are now using for the sickest patients in our intensive care unit. And it's where we collect plasma from those who have been infected and recovered. They donate plasma at a Red Cross, and we give that to the sickest people in the ICU. It's very analogous to what used to be called serum therapy long ago, but it's the same thing. We're giving antibodies from someone who has made antibodies and recovered to a person who is sick and struggling through it. And now the classic question, does COVID antibody mean COVID immunity? And I would love to give you an absolute answer. I think I've said this before. If what I say this week is true next week, then that means the epidemic is slowing down. This is a very fast-moving train. So every day we deal with things that we don't have the answers yet. But I will say this, does COVID antibody, this is the blood test, does COVID antibody mean COVID immunity? It's possible. In fact, it's probable, but still completely unknown. But we think it is really, really pointing to that direction. There is still a caveat. Even if COVID antibody means immunity, we don't know for how long. It's unlikely, this virus has a different structure, so it's unlikely like measles or mumps or German measles where you have lifelong immunity. It may be a temporary immunity if there's immunity at all. So that's where we are with testing. I'll stop there so I don't take up too much time, but certainly available for any specifics. And I have to thank Supervisor Anderson for introducing it absolutely perfectly.
Good information, Dr. Joseph. Always appreciate that.